trying to experiment this year by introducing the theme of arts and health. Our conference theme this year is Renewing Public Health, Renaissance and Responsibility. We've also emphasised very strongly this year the arts and health theme. I'd like to welcome Dominic Slowey, who's the Director of Operating Theatre, which is a drama group, professional drama group based here in Newcastle.
How do we help people to empathise with patients better? And whilst we can't give everybody a crisis, we can take everybody to a story.
The thing that makes me maddest of all is when people look at us. I can see it in their eyes. They're looking at us and they're thinking, she's disgusting. Why doesn't she lose weight? I bet she stuffs her face with chips every day. Well, it's not true, I tell you.
From a GP's perspective, I think from the workshop, I'd get off her case a bit, really. I'd be aware that the real issue for Marjorie is her self-esteem.
Abby Slane, married, pretty.
Without fail, people really connect with it. And even though it's pretend and make-believe, people are able to talk to the character as if the character was real.
I didn't want any extra years. That was the point. I didn't want to go on chasing them. I just wanted to eat the food I wanted to eat. Butter and cheese and eggs and me scone with clotted cream piled on it. That's what I told the doctor.
Actually, I did relate very much to that woman because I'm the same age as her and thought, well, how am I going to be treated when I'm 72?
Developed over the years a highly successful mix of plenary and parallel workshop sessions plus poster presentations. This is an exciting time for public health in the UK, and we are looking forward to hearing your views about the hopes and fears that you have for the future of public health.
I believe we need much stronger action at a European level.
The latest public health white paper in England represents Act 3 of modern public health in this country.
Probably the greatest health inequality of all is that environmental toxins are affecting the most vulnerable groups in our society.
We see a growing burden of chronic disease being placed on the NHS.
We require structures to be in place to enable nurses and midwives to take on leadership roles in public health.
We need a politics of well-being. Economic output in the UK has doubled in the last 30 years, but happiness has been resolutely flat.
Choosing health gives us a major challenge.
In addressing the public health agenda and choosing health, we need to keep focus on the needs of black and minority ethnic groups.
public health and all the kind of different words that we've been using, it's about well-being, but it's not just about well-being and being well, but it's about feeling well.
We can't change people's lives, they have to change their lives for themselves, but we can contribute to helping them change.
We have to both act and learn at the same time.
My hope for the future for public health is that we can work together much more seamlessly across all professional boundaries.
Nutrition is probably one of the sciences of the future.
When you attend a conference such as this, you get really encouraged about the projects that are going on throughout the UK.
My main hope for the future is that we reduce the health inequalities gap.
Lead public health from our hearts, not necessarily with our hearts, but from our hearts.
I think we've had a very stimulating conference, a lot of good material coming through. The UKPHA has a clear, distinctive role emerging. People feel very energised by what they've experienced over the last 2 or 3 days, and to that extent they're passionate about the agenda and they're very anxious and keen to promote it.
I mean, this conference is the public health conference of the year.
Really good to actually get out of the conference site and see bits of the town and projects that are going on locally.
Well, it's been a great experience because there's been so many people around that we've bumped into on these corridors.
I am optimistic, yes. One has to be optimistic. We've got an election coming, we've got a new health team coming in, we mustn't lose the momentum in public health, and this conference I think is giving a very clear signal that we've reached a tipping point and public health is now going to be on the agenda of every incoming government.
UKPHA is just essential to public health in this country.
There's a feeling that we've got to do this, but now there's hope that we can and we will do it.
The future's definitely bright. It's green and yellow, UKPHA colours.
Now, bet you were smiling a little bit inside. Your arteries have now opened up a bit, your blood's flowing a bit more freely, and you're all much better off as a consequence.